My name is Cassandra Sams. I work as a gynecologist in the Health and Human Services Department on a local college campus. I primarily deal with young women between the ages of 18 and 25. Over the past year, I've seen an increase in the prevalence of leiomyomas in the women that I treat. Previously, I would see perhaps 20 women out of 500 presenting with leiomyoma. This past year, I've seen closer to 80 women out of 500 presenting. The main symptoms that I have seen are menorrhagia, dysmenorrhagia, pelvic pain and/or pressure that does not lessen after the end of menstruation, myalgia in the legs not resulting from exercise, and dysuria. I typically recommend a reduction in alcohol intake, a reduction in the consumption of red meat, and an increase in the consumption of green vegetables and fresh fruit. I also recommend the addition of light exercise such as yoga, in some cases the cessation of heavy exercise, and vitamin D and iron supplements. When these changes do not appear to lessen the symptoms, then I start recommending a progestin-releasing IUD or tranexamic acid to control the menorrhagia and dysmenorrhagia symptoms. On average, the lifestyle and dietary changes seem to help control and lessen the symptoms of leiomyoma, and only in approximately 35% of cases do I need to prescribe medication to help manage symptoms. Very rarely do I have a patient that has symptoms severe enough to consider more intensive treatment options. One patient that stands out is a 23-year-old African-American woman who presented with severe symptoms. She comes from a mid to low SES family in an impoverished inner-city area and says that she has always had menorrhagia since the beginning of her menses. She started oral contraceptives at age 14 in an attempt to manage her menstrual cycle. She is overweight with a BMI around 28.9 and says that both obesity and menorrhagia runs in her family. After adapting the lifestyle and dietary changes I initially suggested, she showed a slight decrease in the severity of her symptoms, but still struggled to manage them overall. We spoke about medication options and decided to try the IUD. Symptoms lessened further but were still too unmanageable for her. She is one of the few patients I had that presented with symptoms severe enough to consider more intensive treatment options. After speaking with her family and her general practitioner, A decided that she would look into surgical options. Ultimately, it was decided that proceeding with a uterine artery embolization was the best course of action for her. Fortunately, the procedure went well and had no complications. While leiomyoma rarely presents with symptoms as severe as A experienced, there still needs to be more education on this topic for young women, especially for those of African American heritage. Since I work primarily with female college students, I have put together a presentation that speaks about this topic. Fortunately, I had a decent attendance at the event I hosted and was able to work with some departments to have it count towards a health challenge that the college puts on every year. Many students who attended had questions regarding the issue, and I had several departments request that the information be presented every semester as part of the challenge. I have had great success with the lifestyle and dietary changes in treating the symptoms of leiomyoma in the majority of my patients, and many of them appreciated the more holistic approach to treatment. However, I do believe that there is a need to develop a more effective and comprehensive treatment option that does not require surgical intervention.